Hello, everyone. Thank you for joining us today for USDTL Toxtime. I'm your host, Madeline Tellerico. Today's presenter will be Dr. Donna Coy, Laboratory Director at USDTL. She will be discussing ChildGuard testing, environmental exposure, and fentanyl insights. Without further ado, I would like to turn this over to Dr. Donna Coy.
Hi, Madeline, and thank you for the introduction. I'm going to share my screen and we will get started. All right, thanks everyone for coming to our talks time today. Again, the title of the talk today is ChildGuard Testing, Environmental Exposure, and Fentanyl Insights. So today's topics are going to be substance use statistics, pediatric substance use exposure, environmental exposure, specifically ChildGuard testing at USDTL, what is fentanyl, interpreting results, and case studies. So first, I want to start off with a couple of definitions of terms we'll be using throughout the presentation. And the first is substance use. Substance use is the consumption of a substance that could be detrimental to one's well-being. And some examples of those substances would be alcohol, tobacco, nicotine vaping products, or drugs, whether those are illicit or prescription misuse. Also, substance use disorder, which is a recurrent use of a substance causing clinically significant impairment. And some of examples of that could be health problems, disability, or failure to meet responsibilities. So first, I wanted to get into some statistics. And each year, SAMHSA releases a national survey on drug use and health annual report. And the most recent report that's been sent is 2021. So I wanted to highlight some drug use statistics from this report. So this graphic is showing general substance use and nicotine vaping of someone admitting to use in the past month. So you can see that alcohol is the #1 substance of use at 133 million, followed by tobacco products and nicotine vaping. Marijuana comes in next, and then prescription pain reliever misuse, which would include fentanyl. If we look at the past year illicit drug use and look at the different drug classes, we can see that marijuana was the #1 illicit drug used. I know that many states have legalized marijuana at this point, but it is still federally scheduled as Schedule 1 and considered an illicit drug for this survey, followed by prescription pain reliever misuse at 8.7 million. And again, that would include fentanyl. If we break down the prescription pain reliever misuse, of those that admitted to misuse, almost 47% of the drug used was hydrocodone, followed by oxycodone. And you can see about halfway down, fentanyl was at about 6% of misuse prescription drugs. Now that we see the substances that are commonly used, we can switch over to talk about substance use disorder. So in the past year, 46.3 million people admitted to a substance use disorder. That's about 16.5% of the population. And if we narrow down that group, again, the #1 substance use disorder was alcohol at 29.5 million, followed by drug use disorder. And then if we break down the drug use disorder, fentanyl would fall in the pain reliever use disorder at 5 million people. So based on substance use and substance use disorders, this puts the population at greater risk of overdoses. So you can see in this chart, we're looking at opioid overdose death rates from 1999 to 2019. So you can see that the natural and semi-synthetic, which would be like morphine, codeine, hydromorphone, or hydrocodone, that is on a steady increase. But you can see that in 2013, the synthetic opioids, other than methadone, so this would include fentanyl, we had a drastic increase in overdose deaths from 2013 to 2017. Of about a 75% increase, and that also continues to increase. So thinking about how this relates to child abuse and child safety, we can see the prevalence of parent alcohol or drug abuse as a condition of removal in the United States has been increasing. So from 2000 to 2019, this chart shows all children in out-of-home care for some point during the past year, and the reason being because of alcohol or drug misuse. So you can see this has an increase from about 18.5% to almost 40% in 2019. So it's about a twofold increase over 20 years. So how does this relate to safe conditions for children? So right now we know that 2.1 million children live in a household where at least one parent has an illicit substance use disorder. And these environments are unsafe for children, whether that be exposure to substances or neglect from their caregivers. We also know that children in these environments are 2 times as likely to be hospitalized for somatic illnesses, injury, and psychiatric disorders. They're also over 4 times more likely to experience neglect and almost 3 times more likely to experience abuse. So if we break down these numbers a little bit more, that means that 1 out of every 35 kids is living in or potentially living in a substance use environment. So how can we kind of relate more to this number? So let's talk about a classroom size. So if we think about the general size of a classroom in the United States, we can make an assumption that the size of a classroom is about 35 children. So that would mean that one person or one child in a class could be living in a substance use home. So if we think about our own local elementary schools, whether we have kids in those schools or no kids that are enrolled, we know their friends and their parents, there could definitely be children at your local elementary school that are in a substance use home. And if we think about how many children are enrolled in an elementary school, the average US elementary school has about 500 students. So if every 1 in 35 are experiencing a substance use home, that can mean there could be up to 14 kids in just one local school. So that really brings into perspective the issues with substance use and childcare. So how does this relate to drug testing? So we know generally for drug testing, we're testing the parents and not the children. But what if we could test the children? So USDTL had a CPS case in a Midwestern state where the mother and father were both known methamphetamine users, but the CPS case manager was having difficult time getting valid urine or hair specimens from the mother and father. So the father would come in shaved head to toe, or the mother would come in with her hair bleached and also shaved, or they were getting really good at avoiding detection with urine testing. So they were timing their testing or drug use just right, that they were passing those tests, but there was still suspicion of methamphetamine use and that the child was in a dangerous environment. So generally for hair testing, a drawback of that can be environmental exposure, because most workplace drug testing and DOT testing, we're looking for ingestion or use, and we don't want to know if they were environmentally exposed. But in this case, the thought was maybe we could test the child's hair for environmental exposure. So sure enough, the child's hair was tested. It was positive for methamphetamine, and that child was removed from that dangerous environment. So since then, we've launched the ChildGuard hair testing, and we do hundreds of cases a month. And the difference in that testing is for normal hair testing, we do before we process the sample, we wash the hair with an organic solvent to try to get rid of some of that environmental exposure. And for ChildGuard testing, we do not wash the hair at all so that we preserve all of the environmental exposure. So I want to go over how drugs are incorporated into hair. This can be a very complicated process, lots of things happening at once and overlapping, and can make it pretty complex. So we're going to look at the 3 main ways that drugs or substances can be incorporated into hair. So first I wanted to highlight that hair is made of keratin, just like your fingernails, and the hair structure is alpha helical. So that means the drugs can bind all the way around the hair shaft. So for the first way drugs can be incorporated into hair is environmental exposure. So this is when drugs or substances are smoked, handled, or distributed in the environment. Those can get into your hair, bind to proteins and pigments, and it can be immediately detected after environmental exposure. In this case, the drugs we're testing for, we would only see the drug and not the metabolite, as the drug is not ingested, it's just environmental exposure. The second way drugs are incorporated into hair is through sweat and oil from the scalp. So after a drug is ingested, the drug gets into your bloodstream, it's metabolized by your liver, then the drug and metabolites are distributed throughout your body. So those drugs and metabolites can get into your sweat and oil, which then enter the scalp and can get on the hair shafts and get incorporated into hair. So after drug ingestion, detection from sweat and oil of the scalp could be detected up to 2 to 3 hours following a dose. And in this case, we would find the drug and drug metabolite because it would be indicative of ingestion. And lastly, the way that drugs are incorporated into hair is through blood deposits to the root. So again, after you ingest a drug, it's going to get into your bloodstream. It's going to be metabolized by your liver. So the drug and drug metabolites are going to travel throughout the body, and the blood vessels in the hair root can deposit drug and drug metabolite into the hair and into the hair shaft. So for this type of drug testing, we're not doing a hair follicle test. That's for DNA testing. We're just testing the hair. So it can take up to 2 weeks for hair to grow past the scalp line to be tested. So once drugs are ingested from the blood route, it would take about 2 weeks before we would see the hair grow past the scalp line and be able to detect ingestion. So what does this mean for the window of detection? So again, all of these processes are going on at the same time. They're overlapping and they create an incredibly complex window of detection. Because of this, it's very difficult and we cannot determine the time, dosage, or frequency. Hair is a reservoir matrix, so that means over time the drugs are building up in the hair, whether that be from blood or sweat and oil or environmental exposure. Hair growth rate is about 1/2 inch a month, so it's generally accepted in the hair drug testing community that 1.5 inches of hair is tested. So that means up to the window of detection is up to approximately 3 months in hair. There's also other factors to consider. This window of detection is based off normal daily hygiene. So if someone is excessively washing their hair or using a variety of hair products, that can wash off or wash out the drugs. And then also bleaching, perming, dyeing, or chemically straightening hair can lead to degradation of drugs in the hair and affect the ability to detect them. So we often get the question, can you use fingernails the same as hair, and can they be used for environmental exposure testing? Yes, they can be used, but they're less sensitive. So again, hair has pigments that drugs can bind to. In general, your fingernails do not have pigment. And also, as I described earlier, the hair keratin is in an alpha helical shape, whereas for the nails, it's more, the keratin develops in layers. That's called a beta pleated sheet. And so we only generally see environmental exposure contamination on the top sheet of the nail. So unlike hair, where drugs can bind all the way around, we're only seeing that on the top part of the nail. So how does this relate to environmental exposure in children, and how can they be environmentally exposed, and what does that mean? So there's several different ways. First, the substance could be used in the environment. So it could be smoked or snorted, it's getting into the air. In the environment that the child's around, it's depositing in their hair. Also, if substances are being manufactured in the environment, that could cause environmental exposure. An example would be methamphetamine. There can also be cross-contamination. For smaller children, if they're being held for longer periods of time by the caregiver, sweat and oil from the caregiver could cross-contaminate the child's hair. And in that case, we might see the parent drug and the metabolite in the child's hair. Also, children could accidentally ingest drugs in their environment, whether that be from contaminated surfaces. So younger children or toddlers, they're crawling around, they're touching things, they're putting their hands in their mouth. They could get environmental exposure that way. Or if drug paraphernalia is left out, or substances are left out like pills or powders. So next I'm going to look at some specific drug examples and how to tell if it's environmental exposure or ingestion. So from what we discussed earlier, environmental exposure means we will only see the parent drug in the positive drug if the drug test is positive. If we also see that unique liver produced metabolite, then that would be interpreted as ingestion. And we call this metabolic profiling. So let's go through some drug examples. So first is THC. I'm sure most of you or all of you are familiar with this. It's the psychoactive substance in marijuana. So if we're interpreting a hair test result and we only see THC, that would be indicative of environmental exposure. If we also see the unique liver-produced metabolite carboxy-THC or THCA, that would indicate ingestion. Next is methamphetamine. If we have a hair test that's only positive for methamphetamine, that is indicative of environmental exposure. If we also see the unique liver-produced metabolite amphetamine, that would indicate ingestion. There's also a special case for amphetamine where we may only see amphetamine positives because it is a drug. Common names are Vyvanse and Adderall, used for ADHD. So we could potentially see amphetamine alone if someone is misusing Adderall or Vyvanse or they have a prescription for it. But amphetamine does not metabolize into methamphetamine. So amphetamine alone, positive test does not indicate methamphetamine use or environmental exposure. Next is oxycodone. So this is a semi-synthetic opioid. If we have a hair test where we see only oxycodone positive, again, that's environmental exposure. If we see oxycodone with the unique liver-produced metabolite normoxicodone, then that would be ingestion. Fentanyl, what we'll be talking about today, again, this is a synthetic opioid. If we see only fentanyl positive on a hair test, that would be interpreted as environmental exposure. And if we see the unique liver-produced metabolite norfentanyl, that would be interpreted as ingestion. There are some drugs that are harder to interpret, whether they're environmental exposure or ingestion. And one good example is cocaine. So cocaine is metabolized to benzalketone, but this the metabolite or decomposition product can also be produced in the right environment with the right pH. So your liver is not required to produce this metabolite. So we could see cocaine in benzalketone as a positive, but not be able to tell if this is environmental exposure or ingestion. We'd have to look at other cocaine metabolites to try to make that interpretation. And heroin is a very similar example. So the direct metabolite of heroin is 6-monoacetylmorphine, which is 6-MAM. Again, this is not a unique liver metabolite. In the right conditions with the right pH, heroin can decompose to 6-monoacetylmorphine. So this, the presence of this metabolite would not necessarily indicate ingestion. It could be environmental exposure. So now we'll switch over and talk a little bit more about fentanyl. And I just grabbed some news headlines this week from Google. And of course, there's new headlines every day. Examples here, this top one, child in a hospital in Atkin County. It was a 2-year-old that was found unresponsive. Paramedics were called. They gave the child CPR and naloxone. Naloxone is a opioid antagonist, so it reverses the depressant effects of an opioid. So the child was brought to the hospital in stable condition. This middle example in Nevada, the parents facing murder charges. The 8-month-old was exposed to fentanyl. It was found out that the parents had spilled some drugs on a bed, and then the child was allowed to crawl around on the bed, and they were exposed to fentanyl. And unfortunately, the child did not survive. This last example here is from Minnesota, and they're reporting increases in child fentanyl exposures to their poison control hotline. So you can see that fentanyl is very prominent in the headlines and is definitely a cause for concern, not only for substance use, but child safety. If we want to look at the dangers of fentanyl, we can compare a lethal dose to heroin. So these two vials here show a lethal dose of heroin and a lethal dose of fentanyl in powder form. So you can see that you need a much smaller amount of fentanyl to have a lethal dose than heroin. And this would be an example of someone that's novice to drug use, what a lethal dose would be for them. Someone that has repeated use, they may have built up a tolerance and be able to tolerate higher doses of these drugs. So let's talk a little bit more about fentanyl. I've been using the word synthetic opioid a lot throughout the presentation. And synthetic opioids, those are novel psychoactive substances that have opioid-like effects. They're not naturally occurring, but they mimic the effects of drugs like morphine that originate from the opium poppy plant. Fentanyl does have medical uses to treat severe pain. It can be used in epidurals for childbirth, also for pain treatment after surgeries, and end of care for cancer treatment. But it also has illicit use. So it is also being produced on the streets, and it can be used alone or added to other drugs like heroin, cocaine, or methamphetamine. Many times in these instances, the drug user or even the drug dealer might be unaware that the drugs are laced with fentanyl or miscalculate the dose. And that's what makes this really dangerous. So again, to highlight how potent fentanyl is, it is 50 times stronger than heroin and 100 times stronger than morphine. If we look at fentanyl death rate since 2015, the overall US deaths from fentanyl have increased over 7-fold. For children less than 1 year, 10-fold, and for children 1 to 14 over 15-fold. And this is from 2015 to 2021. And also during this time, a lot of these deaths are being more due to accidental overdoses than say suicide overdoses. If we drill down on the years 2019 to 2021 for fentanyl deaths in children, we can see that infants under the age of 1, there has been a 4-fold increase or a 300% increase. 1 to 4, a 3-fold increase, and 5 to 14 years old, a 4-fold increase. All of other age regions have doubled between 2019 and 2021. So if we're talking about a fentanyl hair test or a ChildGuard hair test, what does a positive look like, and what do the results mean? We can go through each of the scenarios. So here at USDTL, we test for the parent drug fentanyl plus that unique liver-produced metabolite norfentanyl. If we see both of these positive, then that's evidence of ingestion. If we see a fentanyl only positive, again, that's evidence of environmental exposure. If we see only norfentanyl positive, that is evidence of ingestion. So in this case, the fentanyl could potentially be present at levels below the cutoff, but the absence of fentanyl does not discount the presence of norfentanyl. Or we might get a negative result. And what this means is a lack of evidence. Either the sample could be positive, but it's below the cutoff of the test. The sample could actually be negative, or we could be outside of the detection windows. So for hair, we're looking at up to approximately 3 months. If we try to compare that to a urine test, which is for the past 3 or 4 days, potentially that urine test could be negative while the hair test is positive because it has a larger window of detection. So what kind of numbers are we seeing at USDTL? This is total number of hair tests and how many were positive in the past 3 years. So before 2021, for our fentanyl test, we only tested for the metabolite norfentanyl because we're looking for ingestion, not so much environmental exposure. In the 4th quarter of 2020, we added fentanyl to our hair testing to add that to our ChildGuard panel. So here we're looking at 2021, 2022, and 2023. And you can see in 2021, our positivity rate for hair samples tested for fentanyl was 8%. In 2022, that increased to 9.4%. And in 2023, for only the first half of the year, we're already at almost 12% positivity rate for fentanyl in hair. So these numbers are all inclusive of our hair testing, including our regular hair testing and our ChildGuard. If we break this down to just ChildGuard hair testing, I didn't include our 4th quarter of 2020 here when we added fentanyl to our test. And of the 83 tests we had, 14 were positive. This is about an 8% positivity rate. In 2021, you can see we increased the number of tests, the blue bar, and the number of positives, and our positive rate was around 20.5%. In 2022, we had a significant increase in the number of tests, and our positivity rate stayed around 20.2%. And for the first half of 2023, we already have almost as many tests as we did in 2022, and our positivity rate is 23%. So we do expect this year to double the amount of fentanyl ChildGuard testing that we're doing here at USDTL. So we talked about how drugs are incorporated into hair. We've looked at some specific drug examples, and now we'll look at some case studies. So this first case study is a participant that's ordered to be in a program ordered abstinence. Their drug of choice has been methamphetamine. And through this program, they should not be associating with any known drug users. So here for the participant, their head hair, toenail, and urine were tested. And they were found to be positive for methamphetamine in their head hair at 7,856 picogram per milligram, but they were negative for the metabolite amphetamine. So this is indicative of environmental exposure. And then both their toenail and urine tests were negative. So the negative urine test indicates no ingestion, and a negative toenail, because your feet are usually covered by footwear, we're generally not going to detect environmental exposure there. So that negative is to be expected. However, their significant other that they were hanging out with was positive for both methamphetamine and amphetamine, which is indicative of ingestion. So that means that would indicate that this participant is associating with a known drug user and that they could be violating the conditions of their abstinence program. In this next case study, this is a nurse that's in a program ordered abstinence. Their drug of choice was oxycodone, with their head hair, fingernail, and toenail tested. Was found in their head hair. They had oxycodone at 782 picogram per milligram, but no normoxicodone metabolite was found. Their fingernail was positive at 256 milligram. Again, no metabolite found, and their toenails were negative. So this would be interpreted as environmental exposure. And in this case, this person being a nurse, they could be handling oxycodone pills, get residue on their hands and fingernails, and potentially when they run their hands through their head hair, get some environmental exposure there. So that's another reason why their toenails are most likely negative, because they're wearing covered footwear while they're working. Next case is a DCFS investigation where the participant's drug of choice is marijuana. So here the participant and their two children were all their head hair was tested. The participant had a positive THC at 1,126 and a positive metabolite carboxy THC at 0.12 picogram per milligram. This would indicate ingestion. Their 2-month-old was also positive for both THC at 168 and carboxy THC at 0.08. So the 2-month-old may have metabolite for several reasons. One, they could have the cross-contamination from sweat and oil of the participant if they're the main caregiver and they're potentially holding the child a lot. Also, the child's only 2 months old, so they could have been exposed in utero. Or they could be exposed through breastfeeding if the participant is breastfeeding the child. Here with the 5-year-old, we see that they have a positive THC at 423 and a negative metabolite. So that is indicative of environmental exposure. On this next child custody case, a mom is accused of using methamphetamine. So the mom, the dad, and the 3 kids were tested. And this one is a good example of what we call stair stepping. So here you can see the mom is positive for methamphetamine and the metabolite amphetamine, indicating ingestion. Father is only positive for methamphetamine, indicating environmental exposure. And then the 3 children, you can see as their ages increase, their environmental exposure numbers decrease. So the 6-month-old has the higher numbers for environmental exposure at 4,500, the 3-year-old at 850, and the 15-year-old's negative. So we can often see this as children get older, they have less environmental exposure. For example, the 15-year-old, they're going to school, they're probably going to their friend's house, they're maybe out of the house a little bit more and not getting as much of that environmental exposure, although they still may be in an abuse and neglect environment. And the last case study I have for you today is another DCFS investigation where the drug of choice is methamphetamine. Here, the head hair was tested for a caregiver and an 8-year-old. So the caregiver was positive for methamphetamine and amphetamine. So that's the metabolite was present, indicating ingestion. Also, they found fentanyl and norfentanyl, indicating ingestion of fentanyl. So likely in this case, the methamphetamine was laced with fentanyl. And then the 8-year-old in this case had a positive methamphetamine and fentanyl, both indicating environmental exposure. So at USDTL, we're on a mission to make a difference. And our vision is protecting and enriching lives, which we do through our mission of using the best science available to provide cutting-edge tools for the analysis and evaluation of exposure to alcohol, substances of abuse, and toxins. If you'd like to get more information, like infographics, blogs, Toxtime events, you can visit our website at www.usdtl.com. We do have a special section for ChildGuard hair testing, along with all of our other testing options. If you'd like to know what testing options are also available for you, you can email us at adultandchild@usdtl.com to get in touch with a sales representative. Or if you'd like to know more about how to order ChildGuard, or how to set up and send samples, again, check out our website, email us, or give us a call at 1-800-235-2367, and one of our client services representatives will be more than happy to help you and get you talking to the right person. So that concludes my Toxtime for today.
Subscribe to our channel to see more videos like this.